Hello everyone. In this video, we'll see about biomedical waste management. Okay. So biomedical waste or the hospital waste refers to any waste generated during the procedures or the research or undertaking any investigation in the hospital, clinics, laboratory or similar establishment. Okay. So when you are doing any procedures, for example, when you are collecting blood sample or if you are collecting any body fluids or blood and body fluids, or if you are treating any patients, or if you are in OT or anything, okay, or in the clinical research, the waste generated when you are doing procedures, at the end of the procedure waste is generated, right? So that generated waste we call it as biomedical waste or hospital waste. Okay. So biomedical waste is dangerous, because it contains the infectious materials. Okay. So when compared to the domestic waste, so domestic waste means the waste generated in the households. Okay. So it is not that infectious, but biomedical waste contains the live, sometimes the human tissues or the biological specimens or the when we treat, right? So that ppe everything will be there, so it is infectious, so it contains hazardous materials. Maybe it infect the other patients if you are not cleaned or if you are not treated properly. So it may harm the patients, visitors or public or the healthcare workers. Okay. So if it contains any needles or sharps, so it can damage the animals or any human beings if you didn't manage it properly, or if you are not discarded it properly, or if you are throwing just in the public places, so it may harm to the other human beings or the other people. Okay. So and if you keep for a longer time in lab, or if you are keeping in OT for a longer duration, it will ferment and attract the flies. Okay. So that's why we have to treat this biomedical waste according to the guidelines provided. Okay. So we have different color coded bins and different methods to treat the biomedical waste. So one by one we'll see in this video. Okay. So coming to the type of biomedical waste, so we have harmless waste. Okay. So for example, if you're using any papers, cardboards in the reception, or if you're writing the reports and all, so those are harmless waste. Coming to infectious waste, it contains the human or animal tissue or organs or any biopsy material, surgery related, or any placenta or anything. Okay. So non-infectious hazardous waste, when you are using any chemicals okay, inside the hospital, so those are non-infectious but hazardous, so you have to be very careful when dealing with that. Okay. So there are mainly 5 steps in waste management. First is reduction, segregation, storage, transportation and treatment. Okay. So reduction means whenever it is possible, reduce the amount of waste generated. Okay. Where we can recycle it, or again we can use, so we can amount the reusable items wherever it is safely possible, so that waste generated can be reduced. So segregation, we have color coded bags. According to that, we have to segregate the waste. We can't dump in single bin. Okay. So in later stage, we'll see that. Okay. Storage means to to the point of generation to the treatment. Okay. There will be a gap, right? So waste is generated in the laboratory and it will be treated in some other different parts. So we have one gap in that, or we have some space in that. So to, like, in that time we will store in a particular bin in the hospital. One, for example, the waste is generated now, immediately you can't treat it, right? So you have to accumulate it, and once one batch you have to treat it, right? So for one material you can't do autoclave, for one material you can't do incineration, so bulk amount you will be waiting. So it is refers to the measure taken to ensure the biomedical waste is kept safely